We all know the importance of getting regular cleanings at the dentist, but did you know that those 6-month checkups could help save your life? Joining us today to tell us how is Dr. David Black with the Blue Ridge Dental Group. Welcome, doctor. It's great to see you.
Good to be here today.
Okay, so you are a member of the Virginia Dental Association, and that group has just launched a new campaign that's called Want a Healthy Body, Start with a Healthy Mouth. Tell us about that.
We've studied the patterns of the public, and a lot of people don't really have an awareness of the Virginia Dental Association and what we do and how we promote health. And so we've decided to launch a 3-year campaign to make the public more aware that the fact that their general health is tied to how their oral health is. And so we're going to be having TV spots and magazine and print media to try to get more people to come to the dentist on a regular basis.
Right, because a lot of people figure, well, if my tooth doesn't hurt or if I'm not having any issues, I don't need to go get my checkups. But really, getting a checkup, you can catch a lot of health issues early. Tell us about some of the things you can catch.
Well, there's early signs of diabetes. And of course, oral cancer is the biggest. Anyone who dips snuff or smokes is a candidate to get a higher candidate to get that. But you can find bleedy gums. Periodontal disease is really a real indicator of something's going on with your body, and so the diabetes is one, and also you can have other blood diseases that'll make your gums be more unhealthy.
And checking for these serious issues, you can do that during your regular checkup. I mean, would I even know, if I went in for my checkup, would I even know that you're doing anything special to look for those things?
We may mention it, and if we're suspicious of something, we would mention it to you. And sometimes we just, you may notice that the hygienist, when she's cleaning your teeth, may lift your tongue and pull your cheeks back and look for white or red spots that shouldn't be there.
Looking for spots, yeah.
Yes.
I do remember actually my dentist kind of doing that move. They move your tongue around and they look at your cheek and they tell you they're looking for spots, yeah.
Yes.
Is it often that you catch something suspicious? Do you have any tales, any stories to tell us about that?
Yeah. I worked for the health department when I first started way back in '72, and there was some oral cancer. We did an oral cancer detection clinic in Southwest Virginia. We went to several places. But the most recent is my brother-in-law's nephew was a smoker, and he dipped, and as a result of that and not going in, he's having his lower jaw removed this month and have to have it reconstructed. So early detection would have saved him a lot of misery.
Yeah, so that's something that could have been caught.
It could have been, yes, early.
All right, and finding a VDA member dentist is pretty simple, right? All we have to do is go to the website, and that is vadental.org. Once you go to that website, you can type in your zip code, and that'll help you find a dentist. Very important to get your checkups, so make sure you find a dentist. Yes. And also we want to mention that Blue Ridge Dental Group has offices, and that's where you work.
Right.
You guys have offices in Salem, Vinton, the NRV, and Smith Mountain Lake areas. And folks can head to blueridgedentalgroup.com to make an appointment. Dr. Black, thank you so much for being here.
Thank you. I've enjoyed it. Thank you very much.